Hello dear patients, today we are going to review the clinical case of 44-year-old man with discharges of mucous character and itch in urethra. This happened approximately in 2-3 weeks after sexual contact, during which he used medications to improve erection like sialis. After a short period of time, mucous discharges started to appear and itch in the canal. During defecation, he also noted mucous discharges from urethra that you can see on the picture. Indeed, we initially suspected sexually transmitted infections. However, according to the patient, the contact was with a condom on, but oral contact was without a condom. So we took analysis of sexually transmitted infections, but they were all negative. So later on we did bacterial culture test, smear test for flora, where leukocytes were found in the number of 25-30. In culture test, fecal enterococcus was found. It was in high concentration, 10 to 7th power. Today it's quite common that fecal enterococcus accompanies chronic prostatitis, its aggravations. So PCA analyses were done. This is prostate-specific antigen in blood. They were normal. An ultrasound study was done on which an enlargement of prostate volume was seen, up to 35 cubic centimeters. Prostate was diffuse and non-homogeneous with small petrificates. In prostate secretion, an inflammation was found of up to 1525 leukocytes within a visual field. Also, fecal enterococcus was found in high concentration. For this patient, a diagnosis of chronic prostatitis aggravation was set. We have quite a lot of patients who suspected sexually transmitted infection after contact. Sometimes after checking for sexually transmitted infections, there may be just an aggravation of chronic prostatitis. Medications to improve potency like Viagra, Cialis and their cheaper analogues facilitate blood inflow to sexual organs. Excessive short-term sexual activity also facilitates the development of chronic prostatitis. Some bacteria that were there before or were acquired by oral contact without a condom can facilitate such aggravation of chronic prostatitis. So what was done for this patient? A classic treatment of chronic prostatitis was done. We are not going to cover it now, as you can watch a separate video on our channel where it is all described in details. Injections of Tongidasa, Prostacor were done. Intravenous antibiotics according to sensitivity. Intravenous antibiotics. First intravenous antibiotics were used, and then they were used in a tablet form. Anti-inflammatory suppositories, massages, laser, etc. were prescribed. This is all what is included into treatment of chronic prostatitis. This treatment was done within 5 weeks, and after that the patient was transferred to home supportive therapy, and in 2 months' time control analyses were taken after treatment. On them, leukocytes were 2 to 3 within a visual field. They were 4 to 6 in prostate, so they got into normal and the patient's complaints completely disappeared. So even if there are some symptoms that are similar to sexually transmitted infections, it's not always the case of infectious factor. Quite often this can be chronic prostatitis, as in this case. If any complaints appear, like pains in the area of prostate, burning, and if there are suspicions on sexually transmitted infections, you can consult urologists and venerologists of our paid medical center of Dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.